Dr. Krongrad, over the past couple years, you've been involved not only in the development of Prostate Cancer Mission in South Florida, but also Prostate Cancer International on a more global level. As a physician, why have you felt the need to promote these initiatives?
I've been involved in Prostate Cancer International and Prostate Cancer Mission in an effort to build bridges. What we see are patients who are frustrated by inability to acquire knowledge. We also see communities interested in prostate cancer other than the patient community who could gain by the acquisition of knowledge. For example, doctors, hospitals, insurance companies, everybody has a little bit of information that is useful to somebody else. And the way to share that is to build bridges. Prostate Cancer International, Prostate Cancer Mission are partly about building those bridges.
A growing number of studies are providing increasingly convincing evidence that many men diagnosed with early-stage prostate cancer today have low-risk disease that may never have significant clinical impact on their lives. How do you counsel these men in your office today?
People talk about risk. People talk about high risk and low risk. Low risk prostate cancer as an example, as a concept. The problem we have is we don't have studies that actually examine and quantify risk. We don't have populations that have been followed without treatments such that we can determine what qualifies some men as having very high risk, meaning clinical problems, and men who have very low risk disease. We talk about these concepts, but at the bedside, the reality becomes that we have to look at all kinds of dimensions of the patient's health. Sure, we look at the prostate cancer information, we look at grade, we look at PSA, we look at stage. We also have to look at things that are not prostate cancer. For example, we have to look at the patient's health to help him make a decision that is individual and the best that it can possibly be for him.
If there is one thing that you think every 40-year-old male should know about prostate cancer today, what is it?
40-year-old men should know that they have every right and every reason to talk about prostate cancer with their doctor. They should know that if one day they are diagnosed with prostate cancer, chances are they will not be in an emergency situation, they will not need to panic, and they will have time once again to talk with their doctor about their specific situation.
There is an increasing amount of data that show the treatment with drugs like finasteride and dutasteride can actually prevent prostate cancer in about 25% of men at risk. Are you recommending such treatment? And if so, for whom?
I generally do not see patients in the primary setting. The question of prevention is one that is best addressed really with a primary physician. And in that circumstances, it is certainly fair to bring up recent data suggesting that with certain medications, there may be a chance to lower the risk of development of prostate cancer.
New guidance just issued by the American Urological Association suggests many men should be getting a baseline PSA at age 40, but that actual testing for men at risk for prostate cancer needs to be individualized. Do you agree with this strategy?
The American Urological Association recently issued guidelines suggesting that a prostate cancer detection decision should be individualized. This is a welcome announcement. I have always believed and continue to believe that any decision regarding the assessment, the steps taken to detect a disease like prostate cancer are absolutely individual.